If Obamacare is so great, then why have over 700 companies and unions asked for waivers to release them from the new law's many mandates? All told, over 2 million Americans have been granted these waivers, but little is known about how one qualifies for a waiver. This is a mystery that a Republican Congress is now trying to reveal, and the man at the center of this process is Representative Cliff Stearns of Florida, who's chairman of an investigative subcommittee trying to get to the bottom of the waiver mysteries. And Congressman Stearns joins us now. So what have you found, Congressman? You just wrapped up the first day hearings.
Well, we found it's not just 700, it's now 922 waivers.
Wow.
And this includes major states. It includes my home state of Florida got a waiver, Ohio got a waiver, Tennessee has a waiver, as well as New Jersey. And it turns out that New York, the state of New York, has applied for a waiver and most likely will get it. And in the Washington Post this morning, Arizona is now applying. And this is only after 1 year. So you can see perhaps the next year is going to bring more waivers. And this really goes to the heart of the problem is if the president was campaigning on this being a bill that was going to solve the problem, then why do so many people need waivers?
Well, and how do you get one? I mean, I was going through the HHS, Department of Health and Human Services, has on their website a list of all the waivers. They don't have 900. They have about 720. But you have the biggest is the states themselves that are getting one. But a lot of unions are in here representing, a couple of thousand unions. But then you have some that are for, like, for example, Kramer Electronics, wherever that is, representing 2 employees. It goes from the macro to the very micro of a company with only 2 employees. What determines whether you get one?
Well, you're right. And McDonald's got a waiver, Waffle House got a waiver, but small companies are getting a waiver. The crux of the matter is the government under the Obamacare has mandated that the first year, this year, the benefits must be up to $750,000. So this is a mandate from Obamacare that every insurance plan must have benefits up to $750,000. It goes up to $1.2 million next year, and the following year, in 2013, it goes up to $2.2 million. So the government mandates it, but they also say that you can't increase prices above 10%. Right. So between the price controls and the mandates, these companies are saying we can't abide by Obamacare's restrictions. We need a waiver. And lo and behold, it's easy to get a waiver.
And that's just, again, if I can put it in another nutshell for the audience, the idea is that the Obamacare has so many federal mandates. It restricts so much of what insurers can do that they can only do it by increasing rates enormously. That's already happened unless they can opt out of some of those federal mandates. And it's that opting out that a lot of these waivers allow, correct?
That's right. They're saying, either the state or the small business or the Kramer Electronics, which you mentioned, they come to the what's called Consumer Information and Oversight, a small company in Bethesda, Maryland, a group of individuals, about 220 people on the government payroll who are implementing this plan. And they say to him, we can't meet your mandates. That is, we can't give the full benefit of $750,000 a year, plus we can't keep the insurance costs down, so we need a waiver. And lo and behold, they get a waiver. And this goes to the heart of the problem. When you mandates from the government and you stipulate you can't increase prices and you can't let the free market work, then people can't comply and they need waivers. And what's going to happen is this is going to explode by the time we get up to the year 2013, when the mandates are going to have to be, the benefits are going to be $2.2 million, and then it's going to go in 2014 to unlimited amount of money. So this goes to the heart of the problem is if the bill is so good, why are they giving waivers so early and so frequently?
Well, the heart of the problem really is that it is uneconomical for a lot of these insurers to stay in business with all these mandates. They're not going to be able to cover everybody with all of the new restrictions in Obamacare, which means that we're going to have to move to a socialized system, something that the government covers rather than private insurers.
I hope the American people understand what just happened with 922 waivers, and this going forward with more waivers. Who's going to fund the fact that we're having universal health care in which employers cannot afford the full benefits? Taxpayers are going to have to step up and pay for it. And so in the end, it's going to be another bailout of the universal health care, Obamacare, through taxpayers.
And the other question, of course, is whether some of the names on this list of waivers received the waivers as a political favor, because they were well connected. A lot of unions on here, a lot of individual law firms and such. You wonder whether there's any political favoritism going on. Did you find any?
Well, we didn't concentrate on that. We just tried to figure out at the heart of the problem is if you need waivers, why isn't the healthcare system going to work as touted? And I think we found that through the mandates and through the, shall we say, price controls, that it's not starting to comply with what we were told. And in a larger sense, some of these waivers perhaps were made for the right reasons, and some of these reasons were made because of maybe emergency. But we just can't figure out why so many waivers so quickly in less than a year after it passed.
Well, and I would like to know, though, Congressman, and I hope you continue these hearings, because I would like to know whether anybody got political favors. This, as you know, leading up to the passage of this health care law, all kinds of charges of political favoritism going on. Maybe it's going to continue right through to the implementation period.
Well, it's interesting. Ohio got a waiver. New York's going to get a waiver. Florida's getting a waiver. I wonder if California's going to come in for a waiver. And really, in a larger sense, I think there should be open hearings when they decide this process, because I think the American people are saying, how in the world would you give an entire state a waiver on Obamacare if the plan is so effective?
And what happens in 2014? Final question. What happens in 2014 when all this implementation really comes up to speed? Are we going to see, based on what's happened so far with the 900 waivers, are we going to see a total pullout of health care from these private insurers?
I think what you're going to see. Now, what they'll tell you is that once we have universal health care, then everybody will be in the system, and that'll bring the cost down, and these people won't need waivers. But what you're really going to see is people are going to ask for waivers in 2014 because they can't comply, and you're going to see states saying, if we're going to have to comply to this unlimited mandate, unlimited benefits, then we're going to need some help. And Mr. Uncle Sam, please come forward and help us. And that's going to be another bailout.
All right, well, Congressman, we're going to stay in close contact with you and find out what these hearings uncover. Congressman Cliff Stearns from Florida, thank you very much for coming in, Congressman. Appreciate it.
Thank you. Sure.